But what could take its place? And that's what I want to talk about today. Because, of course, when you look at these kind of figures, you think we just have to fundamentally reshape the system. We need something totally different. For example, we need a universal national Medicare for all plan, something that I think would be a vast improvement over what we have today. And then we think about the politics of the issue. I mean, look at what's happening right now. We've got conservatives trotting out horror stories, talking about socialized medicine. They call Medicaid and S-chip socialized medicine. You've got John McCain saying, yeah, we should change the system. Let's move everyone out of employment-based health insurance so they can buy health insurance on their own. And let's promote health savings accounts so people aren't bearing enough risk today. They need to have more skin in the game. Yeah, I'll tell you about skin in the game. Here's a guy who had some skin in the game. Yeah, he looks pretty ominous, doesn't he? His name's Felix Meshke, and that's his son on the left. Felix Meshke decided that health savings accounts might be a good idea, so he signed up his family for one. And a few weeks later, he found himself in the hospital deciding whether to put his son in the hospital overnight. And he decided to do it, and they got hit with a huge bill that would have been completely covered under their old health insurance plan. And here's what Felix Meshke said. He said, I felt that I had neither the bargaining power nor the mental capacity. When you're bargaining for a car, you can always say, I'll walk off the lot. But when your one-year-old child has an IV in his arm, you don't have that same option. And here's the thing. Felix Meshke is a professor of finance and management at the University of Minnesota. If he feels that he can't bear this risk, how do you think the rest of us will feel? So we need reform that brings us back into a common pool of shared risk. And yet we know that this will be a difficult task. One political advisor, famous political advisor, summed it up pretty well. He said, there's nothing more difficult to accomplish nor more dubious of success than to initiate a new order of things. The old system has defenders that are strong, while the new system has only lukewarm support from those who would benefit from it. That well-known political advisor was Machiavelli. So we have an embedded system on which millions of Americans rely, and we know that critics of reform are going to trot out horror stories to scare those who are reasonably happy with their private health insurance today. I can tell them, you can tell them, that they shouldn't be. They should be frightened, because the future looks like what Felix Meshke experienced, or like what the Dorsets experienced. But the truth is that it's going to be a very hard fight. And so I've spent the last 5 years or so working to develop a proposal that tries to get around this embedded system, both thinking about the politics of reform and thinking about how can we achieve a system that has the essential goal of health security for all Americans. We don't want some minimal system that requires that people get poor private insurance. But can we get a system that will provide health security to all Americans and yet might also be politically realistic? And that's what I've been trying to do. And I'm happy that those efforts have begun to bear fruit in the sense that some of the work I've done has seeped into the work of the presidential candidates on the Democratic side. And I'll tell you a little bit more about some of the coalition building work that has been taking place around this broad idea. So the essential elements of my plan are pretty simple. It's called Health Care for America, and you can find it on the website of the Economic Policy Institute. They have a project called the Agenda for Shared Prosperity. Basically, it has just 3 elements. It would create a new framework for receiving health insurance for those who didn't get health insurance from their employer. It's called the Health Care for America plan. And that plan would look a lot like Medicare in the sense that you could get a public insurance plan or you could buy a good private alternative, one that I'll emphasize would have to compete on a level playing field with the public insurance plan. At the same time, employers would be required to offer good private coverage or to pay a pretty modest amount, 6% of payroll, to fund coverage for their workers. And finally, I would include a requirement on individuals to get coverage on their own if they didn't get coverage through their employer. But most Americans, about 94% of the non-elderly population, would get coverage automatically through their place of work under this plan. Now, what would be the effect of this plan? Well, I'm very happy to report that according to estimates that were done by the Lewin Group, it was implemented last year, and so I can tell you the first thing to say is that our current system is woefully inadequate. While 61% of non-elderly Americans get coverage through their employer, about 20% are uninsured. And we have a system, Medicaid and S-CHIP, that fills in this gap, and it's been growing in size, but is underfinanced and in political peril in many places. Under the Healthcare for America plan, we would move to a much more stable foundation. Basically, large employers that already provide good benefits would probably continue to do so. About half of coverage would come through that source. The other half would come through the new Healthcare for America plan. In my proposal, at least, Medicaid and the state children's health insurance program would be folded into this new national pool. However, people would get wraparound coverage that would make sure that the coverage they received was as good as what they had before. A couple things to note. The benefits here are very comprehensive: mental, maternal, child health, no cost sharing for preventive care, well-child screenings, and so on. Prescription drug coverage with the government able to bargain on your behalf for lower prices, and importantly, for anyone below 200% of the poverty level, no premium whatsoever, nothing. The maximum premium, yeah, that sounds pretty good. The maximum premium for people who have incomes that are pretty high would be, and this is pretty good too, $70 for a month for an individual and $200 a month for a family. Now, this is just sounding so impossible, right? So I need to tell you about the other side of the proposal. Well, how do I pay for it? How would it control costs? And here the answer is also relatively simple. Because what it does is it builds on the ability of the government to be able to get both lower prices and to get much, much better administrative savings, much better administrative costs. So in the first year, this is just the first year, it would cover everyone, and we wouldn't spend another dime on health care relative to what we would have spent. In fact, we spent $100 million less. So we're getting everyone covered, and this does cover people who are working but who do not have documentation as long as they are in the workplace. And we get everyone covered, and we don't spend anything more. And you can see that a big part of the reason for that is that the administrative savings are huge, right? About $30 billion. All those small private plans that are operated by small employers, for the most part, would be replaced by this broad pool. And moreover, this plan would make the self-employed come into this large pool and pay a very reasonable amount for their coverage. So again, lots of fragmented individual and small plans would be moving from that towards a more universal system.